Welcome to The Impossible Journey, where we dig into the minds of Africa's entrepreneurs who are building sustainable businesses right here on the continent. In today's episode, we speak to Abiola Fashionner MD, an emergency physician and health policy consultant based in Lagos, Nigeria. Her work focuses on capacity building of emergency health systems in low to middle income areas all over the African continent. Abiola's company, Econ, was the medical director for the recently built Eti Osa Local Government Emergency Isolation Center that was part of the COVID-19 emergency response. Abiola, so tell us about Econ.
All right. So Econ stands for Emergency Healthcare Consultants. I started it in February of 2019. But I suppose it officially took off in June of 2019. I'd just come back home to Nigeria. I just quit my really great job.
I'm going to get into that later.
Of madness, and was really trying to figure out what the next step was. And so decided to start this company. I wanted to focus on emergency and critical care capacity building in Nigeria. I am an emergency physician by training.
Okay.
And it's a big hole in our healthcare system because we haven't wrangled with the prospect of how to pay for unanticipated but critical care. And so our healthcare environment here tends to focus on quick, high volume, highly priced procedures versus the bread and butter of medicine, which is what everybody needs. So this was my attempt to sort of wrestle with that question and provide a solution, because a big part of the problem is that we don't have training opportunities for clinicians in Nigeria to acquire this sort of skill set. That's why I started it, and then it kind of grew from there in fits and starts. Yes.
So speaking about the growth, do you want to talk us through your numbers in terms of maybe employees or clients, how things started from that point? Yeah.
So far, we have been running through training programs. We do point-of-care ultrasound training. We do a lot of training around imaging and sorts of point-of-care diagnostics and imaging at the bedside. A lot of training around basic emergency care, life support skills, airway emergencies, trauma emergencies, all of those things, because there are enough facilities in Nigeria, and particularly in Lagos, who are already providing care. But what you will find when you go to most of these places are that the clinicians are not well trained, and that the training is not particularly practical. It's very outdated. It's not based in modern science for the most part. So we're really a training organization, and we've done a lot of those. I think our biggest things have now come out actually this year. In light of the COVID pandemic. It's been terrible personally for people, but been a really great thing for Econ.
There's always a silver lining.
There's a big silver lining to COVID for us. One of the big things we've done this year is that the Etios Isolation Center that was at the Landmark Beach between April and July, Econ were serving as the medical directors for that facility. Okay. So we ran it, we did medical protocols, training, direct clinical care of all the patients from mild to critically ill in conjunction with Lagos State. So that's an example of a place where we provided direct management of patients. We saw over 300 patients, had a 95% survival rate, and we managed critical care, everything, we did it all. And it was fantastic because I had everything I wanted. Equipment, medications, everything. That hospital was a field hospital. It's gone now, it's been pulled down, but it was better than most of the medical facilities that we actually have in the city that are standalone and permanent. So that was a really intense experience because it was right in the middle of the height of the COVID pandemic when everybody was just being sensitized to what it meant for us. And then so far after that, we're working with state governments, specifically Edo State. We're working now, we've just finished a training of about 100 clinicians in the state. A big priority for the governor there is to improve and impact emergency care in the state. So we've been training people there in basic emergency care, basic life support, really trying to improve the quality of care people get in the emergency departments in the state. So that's kind of been, those are two of our big projects. And then we have all the other trainings we're doing continuously around different aspects of emergency and critical care.
So talk us through setting up this business. How does one set up such a business? You know, in this modern world that we're in now, when you speak to individuals who are startups is either they're going into some form of tech or financial services or whatever. So how does one actually create a medical startup?
It's been such a challenge because, of course, I'm not a natural entrepreneur. I'm a doctor. And so most of my career, I had a job. I went to hospital, I took care of my patients, and then I went home. And then I got to Nigeria. And of course, Nigeria stretches you in new ways. And I just realized that what I wanted to do, there was no vehicle to execute it. And so I'm a very solutions-oriented person and a very concrete thinker. And so I thought, okay, then you have to kind of do it yourself. It's now a nice package story, but it took me a while to realize that I had to dip my toe into entrepreneurship. And I haven't actually thought of myself as a startup for a while. My friend Ada was the one that said, Abiola, you are an SME doing a startup. Start thinking like one.
In every definition of the word. Right?
Exactly. And so I had to really realign my thinking. How does one start? You just start. I think I heard that a lot and it was very frustrating. But literally first of all, I think you have to be here. At least for medicine. I was doing a lot of shuttling back and forth before I moved home. And I'd worked all over Africa. Very much in East Africa, Tanzania, Zanzibar, Uganda, Kenya, Liberia, Ghana. I was all over the place. And always
working in different hospitals?
Sometimes working with the same hospital, but doing capacity building and training all over Africa. And it's really difficult to sort of gain traction when you're shuttling back and forth. Yes. People are interested, but they need to see you. And then this is a place where the opportunities sort of happen very suddenly. And you kind of have to be on ground and ready to sort of take advantage of an opening. And you have to be here to read the tide, to figure out how things are moving. So I think the biggest motivator and really the biggest engine for the growth was really moving back home and then mentally committing to staying and being here. And then you just have to start. You have to ask a lot of questions. You have to ask a lot of people. There's a lot of people who've come into Nigeria to do medical and health entrepreneurship and are either doing well or have failed. And I'm not proud in this arena because I know that for me, I'm learning how to be an entrepreneur. And so I'm always asking questions and sort of meeting people and sort of trying to understand what their process is and then crafting my own pathway based on what I'm hearing. And I sample broadly, not just from medicine, from everybody.
You have to benchmark across different industries, right?
Exactly, right. And figure out how people are doing it because it's a jungle in Nigeria, as we said, and it's a no man's land. So you're really creating what you want to achieve.
So let's take a few steps back to your educational background and work experience, talking through those specific journeys that actually brought you to where you are today. Sure. Like, what did you study as? What did you practice at? Where did you work? And how did those things influence you making the decision that you made today?
I studied cell biology and neuroscience. I didn't particularly love cell biology and neuroscience, but I was coming from Nigeria, and if you wanted to be a doctor, you did a biological science. It was illuminating because at least it gives you the foundation for sort of scientific inquiry. It gives you the foundation for how to do things in a regimented and sort of scientifically recognized way. And then, of course, it was my first experience abroad with my peers. We were traveling a lot as children going on holiday, but it was the first time I was in the States interacting with other teenagers. And Rutgers is huge. It's the State University of New Jersey. There's 20,000 students on campus. So you're meeting a whole gamut of people
from all
over the world and all over America. And so that was really influential for me because it stretched me very much. I think in Nigeria, sometimes you run the danger of being a one note because it can sometimes be a crucible. We're all doing the same thing. And then you meet people who are coming from a whole gamut of backgrounds. And that was really influential in shaping just my receptiveness to new ideas. It was my first experience working. I never had a job. So those sorts of things, managing money, managing myself alone without my parents as a 16-year-old. And then, Rutgers was very close to New York. So I was spending a lot of time in New York City and learning other things apart from science. So I was meeting artists and DJs and musicians and dancers. And that's really great because you need to be flexible in your thinking. And you get ideas from all kinds of places, even if you're a scientist. After Rutgers, I was actually planning to work and take a year off and kind of do like a gap year because I hadn't really had that experience. Right. But I applied to medical school and I got in.
Where did you go?
I went to Mount Sinai in New York. So finally I was in New York. And of course my dad, being the, very proper Nigerian banker, is like, you've entered now. What is the gap here? Go. So I'm like, why did I do that? So now I'm in New York for 4 years of medical school at Mount Sinai, which is a historically Jewish institution. And that was a very interesting cultural experience because now I was learning very much about this culture that has been very persecuted, but is very much in the ascendancy in New York, real estate, the jewelry business, medicine, telecommunication, very heavily Jewish. But we're still in New York, which is this extremely diverse city. So again, I was getting all of this influence from being there. And my medical school class, there were 12 Black students, or 12 minority students. We were all from all over the world, and they're probably some of my best friends till today. So my Jamaicans, the Latinos, everybody, we were all there in school, just trying to navigate this field, which can be extremely, it can really be very, it can really exclude you when you're not from the usual background. So it was an interesting thing to navigate, but because you're coming from Nigeria, which is not sort of a background where you're in the minority. We're very loud, we're very aggressive, we're very much a go-getter culture. And then you have to kind of layer that with the way you're viewed in the States, which is very much not that. And so navigating that pathway where you keep your sense of self-esteem and self, but understand your new environment was very interesting in the context of medicine as a woman and then as an African. So that was New York Medical School. I finished from Mount Sinai, and then I decided to go into emergency medicine, which was, again, for me, as usual, typical Biola, was a very circuitous journey because I was actually going to go into general surgery, but I knew that I was going to be a miserable surgeon, and I found emergency medicine by chance. It's a very amazing specialty for people who like a little bit of everything, who like a lot of adrenaline and action, and if you really want to be sort of in the front line, it's a good specialty, and that's very much my personality. I want to think and ponder and reflect, and then I want to act. And so I'm not a natural GP, internist, endocrinologist. There's a lot of cerebral stuff going on there, but not a lot of physical movement.
You're an action individual.
Yes, but I'm not a surgeon either. At some point, I do want to pause and reflect on what I'm thinking or what I'm doing. And so I ended up in emergency medicine, and it was just fantastic for me. It's been such a great specialty for me and for what I want to do. And so Mount Sinai was based in Manhattan on the Upper East Side, but has satellite training institutions throughout the city and in New Jersey. And one of the major training centers for us is actually Elmhurst, New York. It's in Jackson Heights in Queens, which is the most diverse zip code in the entire country. It's 20 or 30 minutes from JFK. So people are literally coming from all over the world with their x-rays in Sanskrit, Hindi, whatever, landing in your emergency department, and you're seeing them fresh for the first time. So it was almost like I was doing global and tropical health in the middle of New York City, and you're switching from Spanish to Chinese to everything in the space of one ER shift. It was amazing. It was an amazing experience, and the ERs are always full, they're packed. We're seeing 100 people a day. You just really get used to moving volume and doing things very efficiently. So I was there for 4 years in this place where the program wasn't very diverse, but the city was giving me all that I needed in terms of this cultural milieu. And while I was at Mount Sinai, it really gave me the opportunity to really start taking my global health career off the ground. So I was working in Liberia for my 3rd and 4th year of residency. I was very interested in women's issues and gender-based violence. And so my senior project for my residency was actually to design a training program around gender-based violence in Liberia, because they had just come out of a civil war and their emergency departments were struggling with caring for these women and men who had experienced extreme trauma now that MSF at the time was leaving the country and sort of moving on.
That's the Medicine Frontier.
Medicine Sans Frontières, Doctors Without Borders. So I worked with JFK Medical Center at the time to execute a training, to do some training around how to treat patients who have experienced gender-based violence. I had been working as a safe examiner in New York. I'm sure you watch like Law & Order SVU. There's the doctor who comes in and does the rape kit. So I trained to do that, and I was doing that in New York. And so I'd had an interest in women's studies all my life. Now I was a safe examiner. It was a very natural sort of mix of of how to care for patients in a much more humane and sort of slow way than the usual emergency care. And then from there, I was always just in Africa, all over the place, doing trainings and teaching. I worked for about 4 years as a consultant emergency physician throughout the States. I was working all over the place. Then decided to go back into training and did a fellowship at the University of Pennsylvania in global point of care ultrasound for 2 years. And that's how I ended up in East Africa, designing and training clinicians in ultrasound. And that experience is really what I've been using in Nigeria. After that, God, it's a long story. I took a job with Henry Jackson. It's a research unit actually in the States that does a lot of sort of vaccine and scientific trials. And they were looking for a regional coordinator in Africa to oversee studies. And they offered me the opportunity to come to Nigeria and be a regional coordinator for the Africa studies. So I was working with Henry Jackson for a year in Maryland, and Henry Jackson actually repatriated me back home. And so I worked with them for a year after I got home, working in clinical research, overseeing studies, and was not really fulfilled. Right. And so I exited the building, and now I'm doing emergency healthcare consultant. Gosh. So that was the trajectory.
What a journey, and what an interesting pathway that you took to get to this point. Like you referenced, you've been in it a couple of years now. So the question is, or what I always like to ask is, what would you say were the greatest challenges you've had in being an entrepreneur in Nigeria?
I might be crucified for this, but I think one of the biggest challenges is actually being a woman. Opinionated, strong women abound in our culture. But professionally, you're always struggling because, especially at least in medicine, it's still very much a boys' club at the top, upper echelons of what we're doing. And so wrestling with that, I'm not a naturally patient person. I'm very, very volatile in my personality. And so trying to learn to sort of restrain myself, because, there's a lot of like microaggressions and slights that you have to sort of tolerate in an effort to sort of get where you need to go. So that's been an interesting thing to navigate. It's not that there's no challenge as a woman in the States, but Nigeria adds its own sort of extra special blend to the sauce. I think one of the biggest ones is just funding and money. Finding money to do things is a big challenge, but also like having to create structure when there really isn't that, or when there isn't a culture of following the rules. So I was coming from a place where it's a very regimented profession. All this legislation is guiding what you do, and we are all in fear of being sued. And then you kind of just come to Nigeria where it really is just the Wild West, and you have to kind of create what you want to see. And so the parts that I've actually had to pull to create this business are the parts I wasn't paying attention to, the underpinnings of operations in the emergency department, how strategy and structure and financing happened, which you don't usually pay attention to as a clinician. They're in place and you just come into work. But here in Nigeria, you have to create that. And so that's been a challenge, sort of going back to experiences and pulling your resources from your network to figure out where you're going to learn that, to create something that is stable and sustainable, has been an interesting challenge. And then it's a technical field, maintaining your skills. We don't have a fully fledged emergency and critical care service in Nigeria, so even staying clinically relevant is a challenge, so that you're still at the forefront of what you're trying to sell.
And you talked about, earlier in the conversation, you talked about how COVID really shaped your business primarily because of the situation with the pandemic. And I guess in any pandemic, emergency care is a gigantic aspect of it.
Yeah.
So that is how COVID shaped your business. So now that we're moving into the ease of restrictions, and we're now beginning to see a lot less, somewhat laxity with people's attitudes towards COVID, and the government easing things up a bit, the airports are going to open soon. You're seeing a lot more commerce and transactions moving around. So what does that mean for your business that was shaped by COVID? So what happens afterward?
I think that we have to sort of capitalize on the momentum. There's definitely an increased understanding that emergency and critical care are necessary parts of our healthcare infrastructure. But Nigeria has a very short memory. And so we tend to forget lessons learned once things are back to normal. And so we're just trying to remind people that, you know, the way it's going globally, there was SARS, there was the Middle Eastern respiratory virus. Well, we're in a place now where we're always going to have a new COVID.
There's always going to be an outbreak.
There's always going to be a new COVID. And so we are going to end up sleeping on the bed that we've laid, which is what we found in this epidemic. There was not that many critically trained clinicians around. We didn't have that many beds for it. We didn't have that many facilities to care for people. We can choose at this point to really focus in on this aspect of our healthcare system that's been very neglected. And some people get that and are trying to do the work. And some people are going back to the status quo and the way it was before. Yeah.
It is indeed a journey.
Yes, indeed it is.
All right, Abiola, thank you so much for being with us on The Impossible Journey and sharing your wonderful experiences as to how you got to where you are today. It's been a pleasure.
Thank you. Thanks for interviewing me.
All right, cool.
All right.